The research on shared values is highly relevant to BD. In fact, I would say we're already practitioners, and that goes a ways back in BD, and I can provide some very specific examples. The largest source of growth in the company over the past 25 years has been in response to a shared value opportunity. Going back to the late 1980s, health workers were being injured by accidental needle sticks, and it introduced the risk of transmission of the HIV virus or hepatitis. And at that time, health facilities, managers of health facilities weren't that concerned about it. It wasn't really an issue out in the public domain. But we took it very seriously, as did some activists and advocates. And we partnered across sectors and collaborated in advocacy work, in getting data out, in doing training, in putting motivation programs in place, and investing heavily in development of safety engineered devices that would protect health workers. Ultimately, this manifested in policy activities as well. And in addition to addressing a key fundamental need of protecting what I would argue is a critical resource, caregivers, this became the largest source of growth in the company. Well, I can provide some examples. So one shared value initiative that we entered into agreement, and they all involve cross-sector collaboration, working across sectors to solve problems that any one sector on its own, whether it's an international agency or government or non-government organization or the private sector, could not address on its own. So one example is we entered into an agreement with the Clinton Foundation in January 2004 to make the necessary immune system monitoring tests for people who are going to receive antiretroviral therapy, people living with HIV/AIDS, broadly available. And this involved a lot of intensive work because it was going into settings that would not otherwise have had the competencies and the sophistication to do these types of tests. But it was also an access agreement. It was a win-win because for the facilities that needed to have this capability, it brought the cost down by about 75% compared to what happens in the industrialized world. On the other hand, for us, it gave us access to a broad new market. So that's been a very, very successful collaboration. We then further introduced training programs, good laboratory practice training, which we've now done in 60 countries. We've trained 6,750 lab technicians how to do these tests effectively. So we effectively built the health system capacity to be able to do this. And of course, by doing that, with trained lab technicians and laboratories that are able, it creates the mechanism for these instruments and these tests to go into much broader use. A very recent example is we're partnering with the President's Emergency Plan for AIDS Release, PEPFAR, and the George Bush Institute for an initiative called Pink Ribbon, Red Ribbon, which is to address women's cancers, particularly cervical cancer and breast cancer, which is a disproportionately high cause of death in young women in developing and emerging countries. And there's a crossover with HIV/AIDS because young women who are HIV positive have a 3 times higher likelihood of contracting cervical cancer, which is actually an infectious disease. You know, people think about it as a chronic disease, but it's also an infectious disease. And this, again, it's an access model. We provide access pricing at a substantial discount, and we provide the fundamental training to enable superior diagnostic methodologies to be put into use. And that was launched last fall. I traveled with President Bush, George W. Bush, and his family in December in Zambia for the first country launch. He's a very nice guy, by the way, having traveled with him. And it's leveraging the infrastructure of PEPFAR through the George Bush Institute. And what was remarkable at the Washington, D.C. launch event, it was George W. Bush and Hillary Clinton together announcing this. And in addition to everything else in shared value, here's the shared value of bipartisanship, because this issue transcends partisan belief. So you had 2 people who you wouldn't expect to see on the same stage at the same time doing something for the greater good. So I think it really embodies that work. And as I said, at BD, this has really become embedded in the way we operate. Well, to spread this concept much more broadly, I think a number of things have to happen, some of which are already happening, by the way. If you asked me about this 10 or 15 years ago, I would say some of the other sectors, so particularly international agencies, may have been closed to the idea that the private sector, that business, could be an effective partner. There would be trust issues, among other things. Some of them well-placed, by the way, others not well-placed. But there would have been an ideology behind it. That's changed dramatically. I've seen it change progressively over the last 10 to 15 years, particularly the last decade. And it's now evolving further, and the degree of openness that I've seen among agencies that otherwise would have seen the private sector as being to be kept at arm's length. I've really seen that change. That's one thing. I think there's really a need also for attitudinal change on the private sector side to get business leaders, particularly senior business leaders, to understand that solving society's problems, using their core competencies, their resources, their workforces, and their technologies to address the fundamental needs of society is great for long-term business success. This is not at odds, and it's not on the side charitable giving. It's not dropping $1 in a bucket someplace. This can become fundamentally core to serving unserved populations, which represents something like 70% of the world's population is underserved. If those markets can be opened up, it will pretty much guarantee the sustainability of companies, particularly multinationals that are doing business globally, also MNCs. So I think this is absolutely critical, but it requires an attitudinal change. Sort of the old hardcore captain of industry type needs to sort of evolve their thinking to understand that you don't have to exploit to gain. You don't have to be pushing something that's either only going to the wealthy in relative terms or may not be good for society, but it's good for business. There's a much bigger world, much bigger opportunity of things that are good for society. And if we can help solve society's problems, we're going to drive success of our enterprises while leaving a lasting legacy that I guarantee you will be the things that business leaders remember long after their careers have ended, but they think back on their life. Well, let me just say that I'm really, really thrilled that shared values and this concept, this way of thinking about the role of industry, the role of capitalism, and the role of cross-sector collaboration is getting this much exposure in the limelight. I commend Professor Porter for using his gravitas and his research to bring this to a level where it will be taken so seriously. Because, you know, all of us, I meet Michael Porter and I expect to see somebody 120 years old because we can go back 30, 40 years, you know, to what we studied in business school, and it was the Porter model. He was at the leading edge of thinking. He was at the leading edge of thinking about transnational management, and here he is, we're still relatively young when I meet him, and he's literally at the leading edge of thinking about how to transition capitalism and the role of business to a much higher order set of values that will also contribute to their success. So I think it's great. Yeah, this is a topic, sort of what's the role of philanthropy and what's the role of what might, let's call it shared value, because that's the way we're referring to it here. And what's the difference? Well, there are similar goals. BD may have interventions that we will manifest through philanthropy, through partnership, where we're engaging in charitable giving of cash or in kind or time. The most valuable thing we have is our institutional knowledge, so the time of our associates. But it's philanthropy. We call it social investing. And the goal may be to have specific improved health outcomes. But we're not doing that to sell. We're not doing that even to create a market. It may ultimately help create a market. That's not the motivation. And we create a complete distinction between that and activities that are commercial. They may add as much, I would argue, because of the capacity that you can bring to it. They'll add even more societal value, but it's generating business for the company. And it's very important to keep those distinct because otherwise trust may break down based on a suspicion or an assumption of mixed motives. Somebody might think, okay, you're giving this away because you're trying to get some commercial gain. So we won't let ourselves go there. We won't operate that way. And we have actually very specific policies to distinguish social investing, that's what we call philanthropy, from commercial activity that also solves social needs. And I think in shared value, the key emphasis is really on the latter. I could come in and I can talk for several hours about all of our social investing activities. I'm also personally involved in them, and they're great. We've done some great work there. But what we're here today to talk about is how you can actually solve social needs and gain commercially as an outcome by accessing new markets. Now, at the same time, I don't want that to be misinterpreted to say that you sort of push what you're doing in the industrialized world into the developing world and you find a way to manipulate the situation to sell. That's not what it's about. You have to figure out how you adapt to tailor to the environment that you're operating in to make things accessible, properly designed, affordable, and also surround it with the support services like training or like technical service or repair service, these types of things, because we also provide instruments. You have to have a supporting infrastructure, but that's a different model. Again, the good thing is that they can work towards similar goals, but they're different methodologies with different ways of achieving them. Well, I do think one of the unique things about BD is we've gone beyond this as a concept or even beyond some initiatives that could almost be considered like pilots. We've actually embedded this now into how we pursue strategy, how we deploy, and how we engage in strategic planning. So to bring that to life, we've designed a strategic planning system for our geographies, for our countries, that builds directly off the type of model that you would use to implement shared values. So within that, for example, are identifying the key unmet health needs in the society, including those that are top priorities of the health ministry and those that might be key unmet needs that are not well understood. Determining how our capabilities can be aligned to those needs. Most companies will try to align society to what they do. This reverses it. This would align what we do to the society's needs. Then identifying, doing stakeholder mapping, who are the key agencies and people and leaders who are going to have influence on addressing those needs. How do we engage with them? How do we develop collaborative partnerships? And then specifically, how do you carry it out? That's the basis of our strategic planning model. Then we've recruited country leaders in some circumstances that have no commercial background, limited to no. In India, the person, and I personally recruited these people so I can speak firsthand, these were people, no recruiters were involved. I worked through my network of people I came to know and admire. Our leader in India has mostly a nonprofit background, highly networked, highly collaborative, incredibly high personal integrity. Russia as well, not a place you would expect this to happen. We recruited a country leader who has no commercial experience, but they're extremely intelligent and they know how to do this type of cross-sector collaborative activity. And I had greater confidence being able to teach them the commercial skills, because they have to know those, than I would trying to take somebody who was purely commercial in background and having them understand the dynamics of how you engage across sectors. I think the next key steps will be we will establish training curriculum. We have something called BD University. It's an internal university. We will establish training curriculum and coursework in this area and keep spreading these methodologies deeper and deeper into the organization. So I would say today we're probably ahead of the pack in many respects because these are sort of embedded in the way we operate. But I can start to envision where we go from here and also where we will begin to directly align company strategy to the MDGs, particularly the MDGs that have been most difficult to achieve.